Good day, guys. As many of you were asking me about the answer keys for your pathophysiology sample test, I decided to record a short video, as short as possible. I will try to make it quick and answer to questions so you can have the answers for your sample tests and better be prepared for your exam. So let's start. Here, what we have 100 sample tests for your pathophysiology exam. And the first question is, in which of the following disorders genetic factors have no significant role? Okay, and here you have phenylketonuria, which is a genetic disease. It has an autosomal recessive inheritance. Then you have obesity, which again can have a genetic component. Mountain sickness doesn't have any genetic component or genetic factor. Any genetic factor is not relying pathogenesis of mountain sickness. Here you have hyperventilation when you're ascending in high altitudes, right? And colon cancer, of course, can have a genetic component. The cancer depends on a mutation. Okay, the next question. In hypertensive vascular disease, an ADPase oxidase is activated by mechanical force, which results in production of superoxide, okay, to react with nitric oxide, leading to the formation of peroxynitrite, thus decreasing the bioavailability of NO, nitric oxide. This may be considered as an example of, okay, this is a vicious cycle. Why? Because nitric oxide is a vasodilator, and when you have increasing of pressure in hypertension, you're supposed to, it would be better to have nitric oxide and to vasodilate, right? But as pressure increases, the bioavailability of NO is decreasing. Bioavailability of NO is decreasing, and so it promotes even more increase in blood pressure. So it is a vicious cycle. The third one, Marie Curie was unaware of deleterious health effects of repeated unprotected radiation exposure. She died in 1934 due to aplastic anemia. So the disease is aplastic anemia. Radiation in this case should be considered as a risk factor for heart disease, actually, because like aplastic anemia can have many causes, actually, but the radiation would be one of the risk factors. The other risk factor, viruses can be not a risk factor for aplastic anemia. Okay, the fourth, 65-year-old man was diagnosed with small cell lung cancer, suffered from dyspnea. He has a temperature of 38 degrees Celsius. Recently, he developed hoarseness, okay, involvement of the laryngeus recurrence nerve. Yeah, the cancer cells are producing ADH, vasopressin. Which of the following are most likely typical pathological processes in this patient? Okay, so we are asking you about the typical pathological process. So straightforward, you are going and like picking hypoxia and the fever. And 1, 2 would be your answers. Recurrent laryngeal nerve palsy is not a typical pathophysiological process, and then neither hypernatremia plus hypernatremia is kind of impossible here because you have overproduction of ADH, so hyponatremia would be illogical. Okay, the fifth, a patient suffered from blood loss. Which of the following is not considered as a compensatory shift? Okay, you have a blood loss, you have a hypotension, so hypoperfusion of the kidneys will promote production of renin. Then you can have production of antidiuretic hormone and stimulation of cortical-releasing hormones as a stress response. So increasing parasympathetic tone is the opposite that you need to do here, actually. So is not considered. Increasing parasympathetic tone would be the answer. Vibrio cholera is always found in patients with cholera. This bacterium also stipulates the pathogens of cholera. Okay, the cause of the cholera is Vibrio cholera. But disease outbreaks are common in summer when much more water and veg are consumed. Low acidity in stomach may be considered as, okay, it is not the outcome. Okay, outcome of the cholera can be, I don't know, the dehydration or something. Cause of the cholera is Vibrio cholera. This is not the main pathogenetic unit. Okay, so low acidity can be a condition under which it is more likely to be infected by Vibrio cholera and develop the disease cholera. Okay, so the answer is C. An experimental drug administered to a tissue preparation is found to inhibit cellular oxidative phosphorylation when given in high doses, and the ATP production drops to 5% of normal. Okay, so you have dropping production of ATP. You don't have ATP. Cell membrane function is diminished, of course. Which of the following substance is most likely to be present in increased concentration in the culture fluid bathing the tissue? So basically in the extracellular environment. In extracellular environment, you'll have increase of potassium, right? Why? Because potassium leaves the cell by potassium leak channels. It is a normal, and it is the basis of the generation of resting membrane potential. After that, you will be using the sodium potassium ATPase to bring potassium back. Now, if you don't have ATP, it means potassium will stay outside and will be increased. So answer is C. Guys, I will try to give you answers quickly to not prolong this video, okay? To make it more, let's say, convenient for you to later watch it. Causes of impaired energy supply are, okay, mitochondrial dysfunction is the right answer. Inactivation of Krebs cycle enzymes. Another right answer, excessive activation of ATPases. Of course, if you degrade your ATP, it will cause impairing of your energy. Inactivation of caspases doesn't have any role here. So the answer would be 1, 2, 3. Increase in intracellular level of calcium during cell injury leads to intracellular calcium. Activation of phospholipase A2, yes, it is the right answer. Disorder of signaling system, okay, it's again a right answer. Activation of proteases, yes. Activation of nuclear endonucleases, yes. So all answers here are right answers. Again, you can check a calcium stress in a cell injury topic. Which of the following might lead to oxidative stress? Increased rate of phantom reaction, of course, because it will generate you like reactive oxygen species, like hydroxyl radical. Activation of SOD. Activation of SOD converts superoxide radical to hydrogen peroxide. Deficiency of alpha tocopherol is a vitamin E, so this is the right answer. The deficiency of antioxidant will lead to oxidative stress. Damage to mitochondria can lead to oxidative stress as well. So 1, 3, 4 would be a right answer here. Activation of salt, no, because salt is kind of converting superoxide radical, neutralizing superoxide radical. So my answer here would be 1, 3, and 4. Mechanisms of cell membrane damage include all of the following except activation of phospholipase is right, increased rate of lipid peroxidation, yes, it's the right answer. Impaired de novo synthesis of phospholipids, of course, right answer, because your membrane consists of phospholipids. So activation of caspase 8 will lead to the apoptosis, right? And in apoptosis, we don't have membrane damage. So except D. Signs of irreversible cell injury include mitochondrial dysfunction, formation of autophagic vacuole, release of lysosomal enzymes, karyolysis. Here, karyolysis and release of lysosomal enzymes would be your right answer, because they will cause irreversible cell injury. In one case, you have degradation of your cellular contents by lysosomal enzymes. In this case, you have degradation of nucleus, so it's kind of irreversible cellular injury. One of the mechanisms of stress-limiting effects of prostaglandin E2 is activation of cyclic nucleotide phosphodiesterases. Okay, which secondary messenger constraints decrease due to local release of prostaglandins. Okay, if it activates cyclic nucleotide phosphodiesterases, here you have only one cyclic nucleotide like cyclic AMP, which would be degraded. So decreased concentration of cyclic AMP would be followed. In a study of viral hepatitis infection, it is observed that cytotoxic T lymphocytes induce death in virally infected hepatocytes. Okay, lymphocytes release perforin and granzyme B to activate the programmed cell death. Which of the following enzymes are the targets for the implementation of lymphocyte-induced killing? Of course, executioner caspases. I hope you will remember, and that caspases actually mediate the apoptosis process. Which of the following findings in the blood plasma may indicate a massive damage to tissues and cells? When your cells died and now they leak their cellular contents, so you will have hyperkalemia and increasing activity of specific enzymes in blood plasma. So here, 2 and 3 would be right answers, actually. Hypercalcemia is a wrong answer because cells are reaching phosphate, so leakage of phosphates will chelate the calcium, so you'll have hypocalcemia. And hypernatremia is again impossible because cells they lack sodium actually, and they are reaching potassium. So 2 and 3 would be right answers. Common cellular consequences of ischemia include, okay, ischemic necrosis we can have, acidosis, yes, hypofunction, yes, increase in intracellular sodium, yes, all are right answers here. Which of the following is not a pathogenetic unit involved in the development of stasis in inflammation? Decreased expression of selectins, sludging of RBCs, slowing the rate of blood flow, increased permeability of the capillaries. Like decreased expression of selectins. This doesn't mean anything actually. Which of the following lead to fat embolism? Leads to fat embolism. Actually, we need to add here S. Fracture of tubular bones, why not? Damage to subclavian vein, it will lead to air embolism. Rapid diving, air embolism. Crashing of pelvic fatty tissue, of course, logically fat embolism. So 1 and 4 would be right answer, option A. Thrombosis is the local stasis of blood circulation, small vessels made in capillaries, decreased blood and other organs to blood flow in burn. It is a formation of blood clot inside the blood vessel, presence of abnormal cells, blood temperature to that. So the right answer here is the formation of blood clot inside the blood vessel that we name thrombosis. Okay. The main pathogenic unit of arterial hyperemia is arterial dilation, is opposing. A venous outflow, no intracapillary aggregation of RBC, it is a stasis, so arterial constriction will be the main pathogenic unit of arterial hyperemia. Growing tumor mass is compressing vessels of an organ. What is the least expected consequence? Okay, when you are compressing a vessel of an organ, you can't have an edema of that organ actually, right? So you can have venous hyperemia, you can have arterial hyperemia, you can have ischemia, but not edema. Or I'm wrong. No, growing tumor mass is compressing vessels of an organ. So no net blood income. If you don't have blood income, like you can have ischemia. Yes, it is right. You can't have arterial hyperemia. I'm sorry, you can't have arterial hyperemia here because arterial hyperemia means dilation of the arteries, basically. So what is the least expected consequence would be arterial hyperemia. If you constrict, let's say, the veins, you can still have edema because outflow of the blood would be affected, and you can have venous hyperemia as well because blood will stay in the veins. So compressing the arteries actually is kind of difficult stuff. So I think the option B would be the right answer. Which of the following is not a cause of hypoxia? Venous hyperemia, ischemia, arterial hyperemia, stasis. Arterial hyperemia can't be a cause of hypoxia because you are bringing more blood reaching oxygen. So arterial hyperemia is not a cause. Local increase in which of the following substances cause arterial hyperemia? Prostaglandin E2 is a vasodilator, histamine is a vasodilator, thromboxane E2 is a vasoconstrictor, acetylcholine is a vasodilator. So here 1, 3, and 4 would be a right answer. So option D. Okay, option D. Okay, we answered this question. Cyanosis is commonly observed in the following conditions: anemia, venous hyperemia, high altitude illness, cold exposure. Okay, here you should pick like venous hyperemia actually can cause a cyanosis. When blood comes rich in carbaminohemoglobin, this means your cyanosis. So venous hyperemia, okay, would be her right answer. Cold exposure actually will lead to vasoconstriction here, and so blood entering the tissue like would be low here. The remaining blood actually can become saturated by CO2. So I think it could be a right answer as well. And anemia, of course, can be a cause of cyanosis as well. So 1, 2, and 4 here would be a right answer. Why in high altitude illness, when you are hyperventilating and when you are losing CO2, you can't have cyanosis actually because CO2 is lost, to be honest. So, a 3-year-old child has failure to thrive. His both parents are healthy. Genetic analysis revealed the mutation in a gene which encodes an enzyme. The metabolic block results in accumulation of toxic metabolite. What is the most likely risk of having similar conditions in his siblings? Okay, both parents are healthy, means they are heterozygotes, and we are talking about the enzyme. So most probably the inheritance pattern is autosomal recessive. So from two heterozygote parents having autosomal recessive, let's say homozygous autosomal recessive genotype, actually is 25%. Okay, so 25% chances that their one of their children, any of their children, can have a disease here. Uh-huh. So which are the following, and 50% are would be chances that the offspring would be carrier of the mutation, and 25% of the chances would be that the offspring will completely be healthy without any affected allele. Which of the following are multifactorial diseases? Okay, essential hypertension is a multifactorial disease. Diabetes mellitus type 2 is a multifactorial disease. Down syndrome is a genetic disease. Hemophilia is a genetic disease. So here 1 and 2 would be right answers. Which karyotype may be found in Marfan's syndrome? Okay, Marfan's syndrome. At 47X6Y, it's a Klinefelter. 46XS is actually a normal genotype. 45X is a Turner syndrome. 46XY is a normal genotype for male. So Marfan disease is actually monogenic disease. Here you have a mutation of your fibrillin gene, gene coding for fibrillin, and the fibrillin forms, let's say, sheet around the elastin proteins. So it is not a chromosomal disease. Here the mutation is a gene level. So 46XX and 46XY would be the right answer. So 2 and 4 here can be a karyotype of a person with the Marfan disease. In autosomal dominant inheritance, prevalence is the same in both genders. Only heterozygous genotype has clinical manifestation. No. Healthy parents have healthy generation. No. Within affected families, healthy individuals have affected genes. Actually, no. Turns out this question doesn't have a right answer. No. And prevalence is the same in both genders. Yes, this can be a right answer. Only heterozygous genotype has clinical manifestation. Why not homozygous dominant? So 1, 2, okay. Healthy parents have healthy generation in autosomal dominant inheritance. Here, yeah, 1 and 3 would be the right answer. So if you are healthy, if you are talking about the autosomal dominant disease, so the offspring would be healthy as well. Otherwise, it wouldn't be considered as autosomal dominant inheritance. So 1 and 3 would be right answers here. Okay, because this second option is actually wrong, because not only heterozygous can have a clinical manifestation, it's like homozygous can have as well. So just here the thing is that with autosomal dominant diseases, like homozygous genotype usually results in a late stillborn. These affected individuals usually either die in utero, or shortly after like the delivery. So 1 and 3 would be the right answer here. Which of the following is not inherited is as a recessive feature? Phenylketonuria is recessive, alkaptonuria is recessive, lysosomal storage diseases are recessive, Ehlers-Danlos is not a recessive actually, because Ehlers-Danlos codes for structural protein. These 3 are enzymopathies, so usually remember that enzymopathies are inherited in a recessive pattern. Here we have a case. A 13-year-old boy has been drinking large quantities of fluid and has an insatiable appetite. Sounds like Prader-Willi, or large quantity of fluid and has an, okay, he's losing weight and has become more tired. No, it's a diabetes mellitus type 1 actually. Like you have a polydipsia here and you have a polyphagia here. two symptoms of diabetes is losing weight at the laboratory study include fasting serum glucose, okay, high glucose. His parents, two brothers, was are healthy, and maternal uncle is also affected. Okay, which of the following is the probable inheritance pattern of his disease? Okay, yeah, you have hyperglycemia, you have polydipsia, and you have polyphagia. Okay, it's definitely here type 1 diabetes mellitus, which actually is a multifactorial disease, something like that. Although we can talk about the MODI, like we had a type of maturity onset diabetes of the young tubers. His parents, two brothers and one sister are healthy, and maternal uncle is also affected. He's losing weight and has become more tired. I think the answer is C, to be honest, because like X-linked autosomal recessive, autosomal dominant, wouldn't think about it, and having maternal uncle will also affect it doesn't mean anything, to be honest, for me. The child has common recurrent infections. Analysis revealed deficiency of selectins. What is true about this condition? Okay, this is kind of leukocyte adhesion deficiency, and selectins are mediating the rolling. Okay, ENP selectins from endothelial side, L-selectin, and CLA-UVIS glycoprotein is a selectin from a leukocyte side. So he has a defect of rolling. In inflammatory hyperemia, vessels are dilated in part due to axonal reflex. The following are possible mediators except. Okay, so substance P can lead to vasodilation, histamine. Yes, ATP actually, no. Leukotriene B4 here can be considered as a vasodilator. Okay, leukotrienes. The patient complains from a pain in his knee. Which of the following findings will indicate that the lesion is due to inflammatory process? Okay, pain in his knee, which of the following findings indicate the lesion is due to inflammatory, redness of skin, absence of palpable pulse, swelling, limit of the bending of the knee. So here, kind of signs of the inflammation. We are asking you signs of the inflammation. So redness of the skin is one of cardinal signs of the inflammation, right? Like you remember color, dolor, a tumor, rubor, and functional laser, right? So limited ability to bend the knee is a limited functional laser. So it's a right answer. Swelling is a right answer, and the redness of the skin are right answer. 1, 3, and 4 would be right answer. Cardinal signs of the inflammation, the absence of palpable pulses doesn't mean anything. Leukocyte emigration is directed by chemotactic factors. Okay, straightforward answer for this question. Which of the following are not plasma-derived mediators of acute inflammation? Okay, Eigenmann factor kinase complement are residing in plasma, whereas leukotrienes are synthesized by the cells, okay, immune cells, and these are not the plasma-derived. Which of the following are derived from arachidonic acid? Thromboxanes, leukotrienes, lipoxanes. 2, 3, and 4 would be right answer D. Which of the following stimulate chemotaxis in acute inflammation? C5a, yes. Leukotriene B4, yes. So C5a and leukotriene B4 can be chemotactic factors here. 1 and 4. Okay. Chronic inflammation is characterized by neoangiogenesis, infiltration with neutrophils, infiltration macrophages, and fibrosis. Okay, infiltration with macrophages. Macrophages are mediators of chronic inflammation, so option 3 is the right answer. Chronic inflammation can lead to actually fibrosis as well, to be honest. And neoangiogenesis can be actually a characteristic for chronic inflammation. So I would go with 1, 3, and 4 as the right answers. Neutrophils are mediators of acute inflammation. Okay. The next one. Which of the following are expressed on endothelial cells? Endothelial cells, selectin E, integrins, vascular cell adhesion molecules, and selectin P. Actually, E and P selectins are expressed on endothelial cells. integrin, like vascular cell adhesion molecules, as VCAM. We are talking about the VCAMs. 1, 3, and 4 here would be a right answer. Which of the following is one of the first cells? Yes. Beta-2 integrin actually expressed on the leukocyte, the surface of the leukocyte. Which of the following is not contributing to antimicrobial properties of netosis? Okay, not contributing. Opsonization. Trapping of bacteria, reactive oxygen species, myeloperoxidase are parts of netosis. Like nets are filled with enzymes and reactive oxygen species for killing the bacteria, while opsonization is not a property of netosis. For opsonization, we have IgGs, complement C3b, CRP, etc., which is not a typical disorder of immune system. Hypersensitivity, autoimmunity, immunodeficiency, physiological tolerance. Physiological tolerance is not a disease. Which are type of immune pathology is characterized by increased autoantibody level in blood? Anaphylaxis, autoimmune response, immunodeficiency, pathological tolerance. Okay, is characterized by increased autoantibody. Which type of immune is characterized by increased autoantibody level in blood? So, autoimmune response. Why not? Autoimmune response is a, let's say, work of adaptive immune system, and autoantibodies are formed by adaptive immune cells like B cells. Anaphylaxis is an allergy. Immunodeficiency is decreasing basically, and the pathological tolerance, it doesn't mean anything. Yeah. A female newborn at the second day of her life develops tetany. Oh, later in her life, she commonly suffers from fungal and viral infections. Okay, her both parents are healthy, although the following are expected findings in this patient, except aplasia of the thymus, 22nd chromosome delay. We are talking about the DiGeorge syndrome. Low immunoglobulin levels, aplasia of parathyroid glands. Exact C, actually. You have a T cell deficiency because of aplasia of the thymus, and the aplasia of the thymus itself is a cause of deletion, microdeletion in the 22nd chromosome, actually. And this in this 22nd chromosome, you have genes like which are coding for development of the third and fourth pharyngeal pouches in embryogenesis. And from the third and fourth pharyngeal pouches, you have development of parathyroid glands and thymus here in this context. Okay, so the option C would be here the answer. In each of the following conditions, activation of complement system is crucial. Okay, Arthur's reactions, no. It's a type 3 hypersensitivity. Systemic anaphylaxis, no. It's a type 1 hypersensitivity. Wood-Pasture syndrome, okay, it is a type 2 hypersensitivity. Graves' disease is a type 2 hypersensitivity. So 3 and 4 would be here a right answer. Okay. Which immunoglobulins play a major role in type 2 allergic reaction? IgA and IgG, IgE and IgM. Immunoglobulins play a major role in type 2 allergic reaction. I would go with IgE and IgM actually. Which mechanisms are involved in damage of cell tissues in type 2 hypersensitivity reactions? Which are involved in damage of tissues type lysis of the cell, okay. You have activation of the complement, so first option is right. C3p complement fragment mediated opsonization, why not? Perforance and granzyme released by CD8 4 cells, no, this is a property of type 4. Opsonization of target cell by IgG, it is a type 2. So 1, 2, and 4 would be right answers. Which one of the following is the most potent and effective antigen-presenting cell? Straightforward, dendritic cell. The dendritic cell is actually a professional antigen-presenting cell. Which of the following is not a mediator of acute fast response? TNF, interleukin 1 and 6 are right answers. You need to know it by heart. While interleukin 4 is not an acute fast response cytokine. In acute fast response, the interconnection of immune system with other parts of the body is implemented by. Okay. And good father is interference of immune system with other parts of the body, and cytokines. Which of the following is not a pathogenic unit of fever? Formation of secondary pyrogens, prostaglandin E2 formation, increase in hypothalamus set point, increase in CGMP. CGMP doesn't have a role here in fever. Which of the following are endogenous? Oh, okay, we solved the half. Hope you are enjoying the process. I didn't look time actually, so hope it is not long. Which of the following are endogenous pyrogens? Okay, interleukin 6 and interleukin 1 can be considered as endogenous pyrogens, okay? Not interleukin 17 or interleukin 2. Mechanisms of increasing body temperature during fever include all of the following except, okay, shivering, contractile contractile function, like you are contracting your muscles, shivering, and you're generating energy. So contractile energy generation. Bradycardia, no. Peripheral vasoconstriction, yes. Activation sympathetic nervous system, yes, because this mediates the vasoconstriction here. So except bradycardia. Activation of which enzyme is necessary for the shift in hypothalamic set point? Okay, cyclooxygenase and generation of prostaglandin E2. Circulatory hypoxia is caused by, okay, heart failure, so the pump is not working, arterial hyperemia, venous hyperemia, no. Here the right answer would be circulatory hypoxia. Okay, venous hyperemia would be right answer. Heart failure can be right answer because heart failure can cause venous hyperemia as well. So 2 and 4. Genetic analysis of child died shortly after birth reveals deletion of alpha globin genes. Okay, here we have a thalassemia case. Which type of hypoxia had caused his death? Hemic hypoxia, because your hemoglobin has a problem. It is unstable. Cyanosis observed in hypoxia develops due to increased level of oxidized HB, ischemia, accumulation of reduced AP, and accumulation of reduced hemoglobin, actually. Because of binding of CO2. Which of the following lead to hemoglobin formation? Phenylacetin, CO, nitrite, CO2. CO2 is not the answer. CO is not the answer. These two carboxyhemoglobin by C2 and carbamino by CO2. So phenylacetin and nitrates would be the right answer. So they oxidize the iron from ferrous iron to ferric iron. Okay, so 1 and 3 here would be a right answer. A 42-year-old woman has cervical cancer. It has shown that the cancer cell readily pass through J1S checkpoint. What kind of molecular mechanism may underlie this finding? Okay, it has shown that the cancer readily pass through. So here, loss of RB. Viral proteins binding inhibit RB would be a right answer because RB inhibits J1S passage of the cell. And here you have a cervical cancer. Remember that human papillomavirus is, let's say, cause of cervical cancer, and HPV-derived E6 and E7 proteins. Actually, E7 protein inhibits RB, and E6 inhibits P53 protein. Okay, so option D is right. Benign tumors are characterized by fast rate of growth. No, it's wrong. Slow rate of growth can be right. Expansive growth, yes. Infiltrative growth, no. So 2 and 3 would be the right answer. These 1 and 4 are characteristics for malignant tumors. Which molecular event appears to be the basis of virtually all neoplasms? Okay. Non-lethal genetic mutation, it is the right answer here. Okay, yeah, this is the right answer. A lymph node, option C is the right answer. A lymph node biopsy of a patient with malignant tumor of lymphoid cells reveals higher levels of BCL2 in the cancer cells. Okay, which of the following mechanisms is most likely produced the lymphoma? Okay, BCL2 is increased, so BCL2 is anti-apoptotic, so you go and pick the lack of apoptosis as the right answer. Methylation of DNA involving each of the following genes may contribute to carcinogenesis. Okay, you have methylation of DNA. It means you are silencing the portion of the DNA which are you methylating. So if you methylate, let's say, a tumor suppressor genes, it will inhibit the tumor suppressor, so you can have cancers. Generally responsible for checkpoint formation. Yes, let's say, for example, RB. Caretaker genes as well. Yes, caretaker genes. Yeah, no, we mean actually a reparative system genes. So 2, 3, and 4 would be a right answer. Telomerase activity is mostly connected with which hallmark of the cancer. Limitless replicative potential is your answer. Straightforward question. Mechanisms of radiation carcinogenesis include DNA damage, right? Transcriptional errors, cell cycle arrest, suppression of immune system. Okay. 1, 2, and 4 would be right answers, because if you arrest the cell cycle, you wouldn't have generation of new cells. It contraindicates the development of cancer. So 1, 2, and 4. Biochemical properties of tumor cells include activation of Warburg effect. Okay. Activation of Krebs cycle. No, we don't want to do oxidative phosphorylation or something. We want to end the degradation of the glucose till lactate, like do glycolysis. Autophagy dependent energy production of nucleotides from glucose. Yeah, this sounds very logical. 4 and 1 sounds very logical. Okay, 1 and 4 would be a right answer here. The viral etiology is proved for human T-cell leukemia. It's right. HTLV1 is a cause. Human T lymphotropic virus. Burkitt lymphoma. Epstein-Barr virus is implicated in the generation of Burkitt lymphoma as a cause of Burkitt lymphoma. Nasopharyngeal carcinoma, again, Epstein-Barr virus. Gastric lymphoma actually can result from H. pylori, chronic infection of H. pylori, which is a microbe. So my answer would be 1, 2, 3, to be honest, because gastric lymphoma can result of like infection, but a microbial H. pylori, chronic infection by H. pylori. Okay, it is not a virus. Main hallmarks of cancer include activation of anti-growth signals. No. A tumor promoting inflammation. Yes. A genomic stability. No. Instability would be right. Autocrine regulation. Why not? They are secreting growth factors that act on themselves, so you are growing. 2 and 4 would be right answers. A patient suffered from gunshot, production of which substance is not increased within several minutes after injury. Okay, corticotropin releasing is increasing because you are under stress. Adrenocorticotropic hormone, okay, follows. Atrial natriuretic peptide, you don't need. Adrenaline, yes, you need. Okay, so C would be the answer here. Which of the following is not a central stress limiting system? GABAergic, opioergic, serotoninergic, prostaglandinergic, stress limiting system we don't have. Final product of sympathoadrenal axis activation is catecholamines from the adrenal medulla. Okay, be careful here. Which of the following is not an effect of epinephrine during stress reaction? Activation of glycogenolysis is a right. The release of insulin, no. Activation of lipolysis, yes. Dilation of protease, yes. So D option is a wrong answer. Stages of general adaptation syndrome include resistance, alarm, and exhaustion. 1, 2, 3. Very straightforward question. Severe hyperglycemia may result in coma because of dehydration of neurons. Glucose is an osmotically active substance. If you have hyperglycemia, the water will flow out of the cells from low osmotic media to high osmotic media, which is a plasma. So you'll have a dehydration of neurons and coma. Choose the main stress mediators: vasopressin, adenosine, ACTH, antioxidants. Okay, ACTH and vasopressin would be my answers. Okay, not adenosine, neither antioxidants. Stress limiting effects of nitric oxide include inhibition of sympathoadrenal system. Yes, why not? Activation of antioxidants, why not? Activation of procoagulants, no. Activation of heat shock proteins, yes, it's the right answer. 1, 2, and 4. Prolonged exposure to elevated ambient temperatures can result in heat cramps, hyperkalemia, heat stroke, hypervolemia. Okay, here actually 1 and 2 and 3 would be a right answers. Yeah, so you get hypervolemia not because you will dehydrate. Just which of the following factors can promote hypothermia? Okay, high humidity, yes. Wet clothing, yes. Constriction of skin vessels, yes. Ingestion of alcohol, uh, uh, ingestion of alcohol actually, like alcohol is a vasodilating. Alcohol is a vasodilating pad. You are losing heat. Now, when you're vasodilating, you are using your heat, and this can actually promote hypothermia. This why like people who are drunk, they feel that they are, let's say, uh, like hot. They feel that surrounding actually is hot, but actually they are losing the heat and they are under risk of hypothermia. So here, constriction of the vessels would be right answer. Ingestion of the alcohol promote hypothermia can be the right answer. Wet clothing. I would actually have all answers right, to be honest. Mhm. Okay, we will leave this question here, to be honest, because I don't find, let's say, all answers here would be right answer. High humidity, wet clothing, constriction of constriction of skin vessels, they are not promoting. Okay, 1, 2, and 4, 4. My bad, my bad. When you are constricting your skin vessels, like you are not losing heat. But when you're like constricting your skin vessels, your skin becomes cold actually, because of no blood perfusion, like decreasing blood perfusion to the skin. Okay, 1, 2, and 4 would be a right answer. Yes, option D. I'm seeing these questions first time, by the way, guys, as you already understood if you are watching this video. Severe prolonged frostbite may result in okay. Severe prolonged frostbite may result in all of the following except intracellular ice crystals, beautiful, gangrene, intravascular thrombosis, fat embolism, except what? Except C actually, like fat embolism. I can't like connect frostbite and like fat embolism. Right, but on the other hand, intracellular ice crystals is very kind of like water became like formed ice, like frozen water actually. Which of the following is not considered as a tissue sensitive to radiation in adults? Which of is not considered as a tissue sensitive to radiation in adults? Okay, here muscle would be a right answer because cells which lost their replicative potential, which are not replicating, like skeletal muscles, they are not under risk of radiation. Whereas the cells which have, let's say, replicative potential, which are in active replication cycle, they are under the risk of radiation, which is not a type of diabetic coma. Okay, hyperosmolar, we have ketoacidotic, we have lactate acidotic, can be neurogenic, no, which is not a type of diabetic coma, it's a neurogenic, okay? Which of the following is not a cause of hyperglycemia? Okay. Increased production of growth hormone, long-term, which of the following is not a cause of hypoglycemia? Increased production of growth hormone. Yeah, this is the answer because growth hormone actually it raises the blood sugar level, so it's a counter-insular hormone. So increasing production of growth hormone can't rise the blood glucose. Which of the following are features of type 2 diabetes mellitus? It's usually diagnosed after, okay, it's right, insulin resistance, right, beta are affected the late stage of disease, the right answer, tendency to ketoacidosis, the wrong answer. So 1, 2, 3. Manifestation of hypoglycemia are satiety, tremor, tachycardia, impaired vision. Okay, 2, 3, 4. Of course, if you are hungry, you can't feel, like if your blood is hungry, you don't have glucose, you can't feel satiety. 2, 3, 4. Glucosuria is observed in MODY diabetes. Yes, maturity onset diabetes of the young. Again, one of the form of diabetes. Insulinoma, no, it decreases blood glucose. So the answer, like MODY diabetes, alcohol consumption, hypoglycemia, severe physical load, hypoglycemia. So MODY diabetes would be cause of glucosuria. Microangiopathy is diabetes mellitus results in increased osmolarity, retinopathy, slow development of renal failure, also damage of the carotid artery. So the retinopathy is a result of macroangiopathy in the diabetes, actually, and renal failure, actually. Atherosclerotic damage of the carotid artery is a macroangiopathy, not microangiopathy. And increased osmolarity doesn't make any sense, to be honest. Okay, so 2, 3. Many chronic complications of diabetes mellitus develop due to enzymatic glycosylation, polyol pathway, lack of sorbitol in tissues, decreasing protein kinase, C-signaling. No, here actually like enzymatic glycosylation of proteins would be, let's say, complications of the diabetes, like diabetic microangiopathy, like one of the pathogenic mechanisms of a diabetic microangiopathy is by advanced glycation and product, actually. So enzymatic, no, it's a wrong answer, actually, guys. And I wanted to say why we have polyol pathway as an answer choices, but the polyol pathway would be here right answer, because glucose is binding to the proteins by non-enzymatic ways. So non-enzymatic glycosylation is a cause of microangiopathy and diabetic complications. And polyol pathway, actually, where glucose is converted into sorbitol, and the tissues which lack sorbitol dehydrogenase, which actually converts sorbitol to the fructose, will suffer sorbitol injury, because sorbitol is an osmotic active substance and accumulates in the cells, like Schwann cells in the peripheral nervous system, right? And it can cause complications like diabetic neuropathy, okay, or cataracts when a sorbitol can accumulate in lens. Okay, so polyol pathway would be the right answer here. The components of metabolic syndrome are diabetes mellitus type 1, hypertension, abdominal obesity, diabetes mellitus type 2. So 2, 3, and 4 would be the right answer here. Type 1 diabetes is an autoimmune disorder. Increase in which of the following may cause hypoglycemia? Insulin, yes, causes hypoglycemia. Adrenaline, glucocorticoids, it's a very simple, easy question, so be careful to not like pick it quickly, do not lose time on this type of questions. You will have this type of questions on your exams. So it's a very straightforward, very easy question. So insulin causes hypoglycemia, of course. Obesity is a risk factor for tuberculosis, no, like cause of tuberculosis, mycobacterium, malaria, no. Essential hypertension and endometrial neoplasm, yes, are right answer. Remember that androgens are converted into estrogens by aromatase enzyme, which is present in, let's say, fat cell adipocytes. So increased conversion of androgens into estrogens results in hyperplasia of endometrium. So you can have endometrial cancer. So 3 and 4 would be right answer here. Increase, okay, 10 more questions. Increase in production of ghrelin leads to increased appetite. Yes. Activation of POMCARP neurons, okay. Increased production of alpha MCH by aquatus, no. Increased production of neuropeptide Y, what? Okay, the 4 is a wrong answer. So increase in production of ghrelin, okay, leads to ghrelin, increases the appetite. Okay, so 1 is right. 1, 2, increased production of increased neuropeptide Y. Okay. Okay, neuropeptide Y is secreted by POMCARP neurons. Actually, so 1, 2, and 4 would be the right answer. While alpha melanocyte stimulating hormone is secreted by AGRP neurons, actually, yes, acuity-related peptide neurons. Okay, increasing capillary permeability is mostly important for what edema? We are talking about the edema. So allergic, why not? Inflammatory, yes, both are cause of increased capillary permeability. So option D would be the right answer. In congestive and renal, you have increased hydrostatic pressure, not permeability. Which of the following may cause hypernatremia? Increased ADH secretion, no. Adrenocortical insufficiency, no. Excessive water administration, no. Yeah. We don't have right answer. Turns out we don't have a right answer for this question. Hyperaldosteronism, yes, can cause hypernatremia. First, I read hypoaldosteronism. Okay, hyperaldosteronism or Crohn's disease actually can cause hypernatremia because you have increase of reabsorption of sodium and water from the collecting ducts and the distal convoluted tubule of a kidney of nephron. Okay. In which of the following conditions the nitrogen balance is negative? Okay, starvation. It would be the right answer. Now, which of the following are causes of hypoproteinemia? Excessive sweating, no. Hepatic failure, yes, because the production of the proteins is decreased. Increased loss of by kidneys, yes. Malnutrition, yes. 2, 3, 4. Which of the following is a cause of respiratory acidosis while you are not breathing? Hypoventilation of the lungs, straightforward answer. Whereas renal failure can lead to, let's say, metabolic acidosis. Or option E, again, metabolic acidosis. The patient's arterial blood gas analysis data are pH 7.3, PaCO2 is increased, bicarb is increased. What is true about this condition? Okay, here you have acidosis, right? So remember how we like teach it you, like what you should do first. Like you should first look for pH, right? So pH shows you that you have acidosis. Then as a second step, you need to look to like a partial pressure of CO2 in the arterial blood. Here you have increased CO2. Increase of CO2 explains your acidosis. So you have a respiratory acidosis here. Okay. So look for respiratory acidosis. Okay. The second option is right. This is a respiratory acidosis. The change in bicarbonate level is compensatory. Of course, yes. Like bicarb is an alkaline component of the buffer of bicarb buffer, huh? So increase of bicarb actually can compensate your acidosis. So option 2 and 3 would be the right answer. After reading an article about hazards of sedentary lifestyle, a 21-year-old medical student decided to climb Mountain Ararat. Okay. The highest point in Armenia, nowadays Armenia. However, he experienced headache, fatigue, and dizziness at altitude 3,200. Okay, sounds like a mountain sickness. His arterial blood analysis is revealed. Okay, you have hyperventilation due to hypoxia. You have exogenous, hypobaric, hypoxia. Okay, so you have hyperventilating, so PaCO2 will be decreased. If PaCO2 is decreased, you have alkalosis, so pH is increasing. 2 and 4 would be the right answers. Extremely high rate of aerobic glycolysis, Warburg effect, is observed in cancer cells. Okay. If we had the embryo, let's say cells in the embryo, human embryo, it would be a right answer as well. Effect of which molecule is decreased in metabolic X syndrome? Okay. Insulin, why not? Leptin, okay. TNF alpha and resistin, no. Decreased. I think 2 and 3 are the right answer here. Metabolic syndrome or metabolic X syndrome, the same actually, synonyms. And the last question: analyze of a biopsy specimen for a tumor showed that a portion of chromosome 3 is methylated. Okay, so the portion is inactive. Again, it is an imprinting, methylation. That area includes VAGL, a tumor suppressor gene. Okay, so turns out you have von Hippel-Lindau disease. What is the result of methylation? Impairment of translation of VAGL protein, increased production of VAGL protein, decreased transcription of VAGL gene. Okay, so methylation silences the gene, makes it like inaccessible for transcription. So you have decreased transcription of VAGL gene. While let's say impaired translation is not affected because translation is a property of ribosomes, not like a gene. Okay, so the option B would be here right answer. Okay, guys, thank you very much. Hope you enjoyed and you can actually watch this video and to revise, like compare with your answers after you're solving like this test. Good luck for your exams, okay, upcoming exams. Okay, thank you. See you. Bye bye.